My presentation is a tale of two mindfulness interventions. I'm going to take you through two studies that we have been working on. And the two populations that I work with right now are pregnant women with depressive symptoms and then healthcare professionals. So they seem like very different populations, but in fact, they are not. I'll tell you more about that. So actually, let me go back. So when we talk about mindfulness interventions, I'm using this as an umbrella term because, in fact, the study that I'm doing with pregnant women is more mindful physical activity, and the interdisciplinary healthcare professionals intervention is a kind of mindfulness and resilience training program. So the first study to tell you about is about these depressed pregnant women. Despite the growing awareness that you may or may not know about with regards to perinatal depression, meaning depression with onset or the experience of depression during pregnancy and or postpartum, the presence of depressive symptoms are often overlooked and undertreated for a number of reasons. Some women are afraid of receiving treatment, but simply because of the stigma that's still associated with depression. Some clinicians are afraid to treat with pharmacotherapy due to what we know about risks to the fetus. We know psychotherapy is a very effective tool for depression, but a lot of women don't have access to psychotherapy. So this work has built upon some pilot studies that we conducted that revealed that pregnant women want to manage their depressive symptoms largely within themselves. They have a drive for self-care during pregnancy. As you can imagine, all of a sudden, they want to take care of themselves and their growing baby. And so we did some focus groups that showed us that many pregnant women were viewing yoga as a very accessible form of self-care, of self-management of depression symptoms. So we built upon that and developed this study. And so briefly, our aims are to look at whether an intervention which involves mindful physical activity during pregnancy, prenatal yoga, whether it's feasible and acceptable to women. Is this something that they can participate in? Is this easy for them to do? And then we want to look at preliminary effects of the intervention over time. So we are delivering this intervention. It's 12 weeks. Women come to a prenatal yoga class for 12 weeks with other women with depressive symptoms in this class. We follow them over time. We look at their symptoms from beginning, midpoint to end, and then in postpartum. And then a really interesting piece of this study, I think, is that we're looking a little bit more under the skin, if you will, to see if we can identify some epigenetic patterns that might be related to depression and might change with intervention. And so I provide this somewhat scary looking figure to give a picture of my team's work beyond just this study, where we're globally interested in the interactions of social, environmental, and epigenetic mechanisms involved with disease processes, and in this case, perinatal depression. So although we don't understand exactly why, we do know that women who experience depression during pregnancy have risk of poor outcomes, maternal outcomes, as well as child health outcomes. And so there is the theory that there's something more than just mom's not doing well and then therefore baby's not going to do well. So the theory is it's a little bit deeper than that. Perhaps there's some kind of change, DNA-based, that is mediating this. And so epigenetics is a framework for helping us understand this, and DNA methylation is one example of epigenetic changes. So DNA methylation is simply when a methyl group is added to a cytosine group. Think back to Bio 101. In the CpG dinucleotides, and this affects transcription rates of genes, okay? So it basically says genes are gonna go on or genes are gonna go off, or some modulation in between. And so there is this, we have seen that individuals exposed to stressful life events have alterations in DNA methylation. people that have depressive symptoms have alterations in DNA methylation, and most excitingly, pilot studies have suggested that when we intervene on stress and depression, we see some changes in DNA methylation as well. So there is something going on deeper than just the symptomatic experience. So this is what we're looking at. By the way, I know my face is getting red. Someone told me once that your face gets red, Patricia, when you talk. It's because I have passion. This stuff really excites me. So just a warning, I get jazzed up by this, and hopefully you guys will too. So my hope as a nurse scientist, as a researcher who's really interested in holistic care of patients, is that by looking at epigenetic patterns, by understanding what's happening under the skin with women who are experiencing stress and depression, we might be able to intervene early for these women. So we might be able to provide prevention strategies, intervention strategies to help improve health outcomes in the end. So you might ask, okay, well, what are your results? Well, the study is ongoing right now. We are actually, our last participant just had her baby 3 days ago. So we will be finishing up all that data collection in the next few weeks and doing some analysis. I just threw together a quick little preliminary data just on the intervention group, not even on the comparison group, which, it makes me happy to see at least on the depression scale, women are going from baseline at a score of around 13, 14, which is moderate level of depressive symptoms, to down to around a scale of around 4. Now, again, these are just general estimated means. This is nothing statistically significant. This is just a quick picture because I wanted to at least show you something. And I was kind of happy when I threw that into my analysis. So stay tuned. We'll have more to report, hopefully within the next few months. Okay, now transitioning to healthcare professionals. Is there any overlap between healthcare professionals and depressed pregnant women? Well, I will say definitely stress is a big overlap there. And we believe, and I have some people in the room who also agree with me, that healthcare professionals, in order to provide good quality care to patients, like say the depressed pregnant women, those healthcare professionals also need to have wellness. They need to be able to think clearly. They need to be calm enough to listen to the needs of the patients instead of always being stressed and overwhelmed. We know that burnout is very costly to our healthcare system. It's costly to the individual healthcare provider because when they are overwhelmed and stressed, all they want to say is, I'm not stressed, you're just annoying, right? So we need healthcare providers that are able to step back, they're able to self-regulate and care for themselves. We know that up to 50% of medical students report burnout, and at least 15% report suicidal ideation at some point during their training. We know nursing students who experience incivility on the units are more likely to drop out from the profession. We know that 500 physicians per year commit suicide, so this is an important issue that we take care of the wellness of our healthcare professionals. So that is why Sarah Braun and I'll just introduce her. If you don't know her, she's a psychology PhD student that we've worked together on this project on mindfulness for healthcare professionals, with the idea that if we train professionals in mindfulness, we might enhance their resiliency to the natural stress of being a healthcare professional. We might help them reduce burnout, stress-related outcomes, and potentially even improve their cognitive functioning, which can impact decision-making, and then enhance interprofessional collaboration, because that's really where good quality healthcare happens. So we have some preliminary data as well that's been published here, and just briefly pointing out the fact that over time we did see significant effects on stress levels, on anxiety levels, and emotional exhaustion, and depersonalization related to burnout. So definitely some positive directions with these preliminary findings. And I want to acknowledge my whole team for various studies, and acknowledge various funding sources. And I think I'm at my time, so I haven't looked at Kirk in a while, but any questions that I can answer, at least initially.